So there are a variety of different diagnoses that we can treat for foot and ankle conditions. I would say one of the most common ones that we see is Achilles tendonitis or plantar fasciitis. Some of the less common ones that we would see would be something like peroneal tendonitis. Post-op care is definitely something that we treat, but maybe not as often. We see post-fracture care, so someone who had a fracture in their ankle and it's being treated non-operatively. We will also treat sprains and strains of the foot and ankle. There are lots of different techniques that we can use in physical therapy to treat those different diagnoses. Some of them would be manual therapy, so working on doing some massage to the affected muscles in the area, working on exercises to build up strength and stability in the ankle and also balance. And then there's other techniques that we can do like vasopneumatic compression and ice and things like that to help reduce swelling and edema in the area. So in more of an acute injury, a lot of times patients will be in either a brace or a boot or something like that with their foot and ankle. So we're looking at getting back their gait mechanics and getting back their strength and stability. The first phase of that would be to get them out of the boot or the brace. So we're working on, doing some gentle range of motion exercises, because when you have been in a brace or a boot for a while, then you're going to lose that range of motion. So that would be kind of the first step, is getting that back, and then working more on weight bearing and putting weight on that foot that you might not have been putting weight on because you were immobilized or in a boot or with crutches. Once we get back that basic strength, then we're going to be working more on stability. So things like balancing activities, and then getting you back to like running and jumping and things of that nature. So it's a lot of things that you might not think to do at home. And I know a lot of people might come in and say, oh, I sprained my ankle. I've done it in the past when I was younger, and I think I can just do this stuff on my own at home. But a lot of it is us just slowly ramping you back up to getting back to your normal activities of running and jumping and squatting and things like that. And a lot of this does take progressions that we need to kind of look over and make sure you're doing them properly in the clinic so that you're not risking re-injuring yourself. So in the first phase of that recovery, like I was talking about with getting you out of the boot or getting you out of the brace or something like that, the time that you're spending in that boot or brace is to allow for the healing. So in general, it just takes time for ligaments and bones and things to heal after a fracture or after a sprain, or say after surgery. It takes time for those tissues to heal. So that's why you're in that boot, and that's why you're in that that's why you're in that brace, is to give that time to heal. So in that time, you are going to lose some strength and you are going to lose range of motion. You don't want to go back too quickly to your regular exercises, because you might not have that strength and stability yet in the foot and ankle. And if you do go back to those activities too quickly, like if you just come out of your boot and you go right to try to run, you're not going to have the strength and endurance and tolerance in those muscles to do that. And so that's when you do risk your re-injury to the foot and ankle, because you just don't have the strength in that area yet. And that's why getting physical therapy is so important to a full recovery, so that we can oversee those exercises that you're doing and make sure that you're doing them properly and strengthening all of the muscles, not only of the foot and ankle, but also of the knee and the hip all the way up. Because when you have been in a boot or been in a brace or been on crutches, then like I said, you lose the strength of those muscles, but not only down in the ankle, also all the way up to the hip, because of the way that you might have been walking. You might have been limping a little bit, and then you do start to notice maybe some pains or some aches in your knee and your hip from the way that you've been walking. So we will focus on not only strengthening the muscles of the foot and ankle, but also of the hip and the knee.